Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Elizabeth. I'm Richard. I'm one of the nurses in this district, nursing. And the doctor has asked me to see you, so I guess you know that.
Yes, I do.
All right, yeah. So please take a seat.
Thank you.
Right, yeah. So, how can I help you?
Well, nurse, it's kind of a bit complicated. I've got this problem with my back.
All right.
And it hurts very bad.
All right, yeah. I've seen your case notes, and yes, I've seen that, yes. So, can you explain the situation you go through currently?
Yes, sure. I experienced this discomfort and a very stiff feeling in my back. It's been long.
All right.
And I used to use some pain relief ointments to relieve the symptoms, but off lately...
It's not working. All right, yeah. So, can you tell me when this started?
It was 1.5 years ago when the pain started.
All
I
right.
was prescribed with some painkillers back then.
All right, yes.
And after 12 months, there was no relief in the pain.
All right, so you have been taking the medicines consistently. All right,
Yes,
yeah, okay.
Well, I could not stand up,
Oh, okay. Right.
for which I was later hospitalized for, say, 2 days.
Okay.
And I underwent some blood tests along with the barium meal.
Oh, yeah. All right, yeah, that's right.
Yeah. So later, after 6 months, I was diagnosed with a tumor in my back.
Oh, all right. Okay. Yeah.
For which I underwent a surgery. And a small part of my bone that was removed.
Okay.
That's what was told to me. And I was also told the tumor was spread to my liver
All right.
lower back. And now that was very sad, and I was worried about it.
All right. So you said you were in terrible pain. Were you given some medicine for that?
Yes, I was. Pethidine 3 times per day, and some alternative modalities for pain relief. I tried acupuncture for, say, 2 months, which I discontinued later.
Oh, so you felt that was not working.
Yeah, it was not.
Did you do something else for the pain?
Yes, I did, and I am still doing it. I smoke marijuana.
Marijuana.
Yeah, dope.
Okay. So that's not the ideal thing you should be doing.
I understand, but
Right, yes. So what are your thoughts about what you are going through?
that's the main reason I've come to you.
Right, yeah.
I've been depressed for quite a long time, and I've been going through this rough phase, and I feel anxious about my illness. Even I get this weird thoughts of ending my life. I considered suicide.
I'm sorry to hear that.
Yes, yeah. But I just want to get this over.
Right, yes.
I need help.
Yeah, but Elizabeth, that's not the way out actually.
I know.
See, I wanted to see you because, there are a couple of things that the doctor wanted me to discuss with you.
Okay.
And I would be arranging some counseling sessions for you.
That would be great.
Yes, so if that's fine with you, I can get that rolling in a few days' time.
Yes, of course.
And that's actually part of an ongoing modalities that the doctor wants for you.
Okay.
Right, and I can also try, some alternative modalities of pain relief.
Okay.
All right, and that would include many things, including acupuncture, acupressure,
Mm-hmm.
and yoga.
I haven't tried it yet.
Right.
Will it be helpful?
Yes, it has helped many people who
Okay.
have gone through things similar to what you go through.
All right.
So those things should be helpful, and that is, they don't have any side effects actually.
Mm-hmm.
And you should be seeing a specialist as well. If that's okay with you.
That would be fine.
Who would particularly help you through this phase of your life and help you to come out of what you are going through.
Yes.
Now look at the notes for Extract 2. Extract 2, questions 13 to 24. You hear an optometrist talking to a patient called Marcia Samarina. For questions 13 to 24, complete the notes with a word or short phrase.
Hi, Marcia Samarina. I'm Dr. Colshaw. I understand that you've been experiencing some issues with your left eye.
Yeah, that's right.
Okay, are you able to tell me a bit about what's been happening?
Yeah, sure. So, last Friday was our office party, and so I was out quite late, and I'd had a couple of glasses of wine. Anyway, when I came home, I must have been a bit reckless taking out my contact lenses. I didn't notice anything then, but when I woke up in the morning, I had this pain in my left eye. It felt like there was something stuck in it. Also, I had a headache. I'm not sure if that's because I was straining my eyes. My eye was also watering loads, and it was kind of like what happens when you chop up onions. Anyway, I thought I'd just sort of keep blinking, and whatever was in my eye would work its way out. So, well, I did that for a bit, but I was getting more and more worried. I went to ask my roommate if she could see anything in my eye, and she said my eye was swollen, and she thought we should go to the hospital and get it checked out. So we went to the ED, and thankfully my roommate was able to get the day off work, so she drove me there. Oh, the pain was also so terrible that I couldn't concentrate. I don't know what I would have done without her help.
Okay. So what happened when you went to the hospital?
So we waited around at the ED for a bit, and then I was seen by a GP. I told him about the pain and how I thought I had something stuck in my eye, so he opened my eye and tried to see if there was anything in there that shouldn't be. It must have been quite difficult for him to see anything, so he did a Fluorescene eye stain test. Then he took me to a dark laboratory room to look into my eyes with one of those microscope things. And when he still couldn't find anything, he seemed to think it could be an infection. And that's when I started panicking.
And after that, were you referred to an optometrist?
Oh, yes, that's right. They sent me to this department after that, and the optometrist used some numbing eye drops on me. I was incredibly thankful to her for that. My eyes felt better very soon afterwards. And then she looked at my eye, and because I wasn't squinting from the pain anymore, she could see that there was a corneal abrasion. She said that I must have scratched it when I took my contacts out the night before.
I see. So can you tell me how you've been treating your eye at home?
Yes, she told me not to wear my contact lenses until this follow-up, and she prescribed me a couple of things. I'm using the antibiotic eye drops she gave me. I put those in the mornings and evenings, and the other thing she gave me is really horrible to use. It's a healing ointment. but it feels gross in my eye, so I just use it once a day. Unfortunately, they couldn't give me any of their pain relief to take home, so I've just been taking ibuprofen when it hurts.
And how's your eye feeling now?
Oh, much better, thanks. It still hurts when there's bright light, though, and I wasn't sure if that was normal. The optometrist said it would take quite a while to heal, so I guess I need to hang on a bit longer.
Yes, at this point it will most likely still be recovering. Do you mind if I take a close look at your eye now? If you can just take your glasses off.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
You hear a dentist discussing booking problems with her receptionist.
Hey Kieran, Mr. Lau just mentioned that he'd tried to reschedule his appointment yesterday, first online, and then when that didn't work, he called up. But apparently he couldn't reschedule. Any idea why?
I wasn't working yesterday, but let me check the notes. So, Lana left a note about the call. She says that Mr. Lau wanted to reschedule, but we didn't have any other appointments this week after 3 p.m., which is the only time he could make. He asked if he could make an appointment next week, but his procedure was marked on our system as urgent, so she had to make it in the same week. The system wouldn't have let her reschedule it any later. She wouldn't have had the authorization to change that. Still, she should have discussed this with you at lunch or at the end of the day, because then you could have decided whether it could have been postponed for a week.
Yeah. In his circumstance, it would have been fine to reschedule at a slightly later date. We should prevent something like this from happening again.
You're right. I'll talk to her about it tomorrow, and I'll send out an email to everyone else so that they're aware.
You hear a doctor discussing chest X-ray information with a medical student.
Hey, Dr. Yan, we've got the x-rays back from Mr. Regis in bed 8 from this morning.
Great. Can you document them in the notes?
Do you mind showing me how to write the interpretation properly?
Of course. Make sure you put the patient details. Full name, date of birth, patient number, and home address first. Then put the hospital and ward, date, and time. Make sure your name is on the document too. Include the indication for the x-ray like hemoptysis or dyspnea before documenting your interpretation. Now, I use a simple mnemonic to make sure I don't miss anything. A, B, C, D, E. Airway, trachea, carina, bronchi, and the hilar structures. Breathing, lung fields and pleura. Cardiac, heart size and heart borders. Diaphragm, position, shape, and costophrenic angles. Finally, everything else, the mediastinal contours, bones and tubes, or devices. Make sure you document everything clearly using this system in the notes.
You hear an ENT surgeon talking to a colleague about cochlear implants.
We implant an electrode array which looks like several small wires made of a platinum iridium alloy into different regions of the cochlea. These metal wires conduct the electrical impulses generated from the microphone, which picks up sound from the environment and sends the signals to the electrode array through a transmitter. There's also a speech processor between the two that filters more important sounds so that the patient can hear people talking rather than other sounds.
Right, okay. So does this restore hearing to normal levels?
No. With the current technology, we're giving deaf people a good representation of sounds from the environment and help to understand speech. After surgery, patients undergo therapy to relearn the sense of hearing. Not everyone benefits from the device to the same extent.
Right.
You hear a GP talk about type 2 diabetes mellitus.
Hello. I'll be covering the diagnosis of type 2 diabetes mellitus. So there are 4 methods that we can use. The first is a fasting plasma glucose test. This is our preferred diagnostic test, as it's easier to carry out, often more convenient, and costs us less than the other 3 tests. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. Normal fasting blood glucose will be between 70 and 100 milligrams per deciliter. A value of over 126 milligrams per deciliter indicates a diagnosis of diabetes. Bear in mind that this test should be carried out twice to confirm a positive result. The second method we can use is to measure the average glycemic load over the past 3 months.
You hear a dentist talking to a patient with a chipped tooth.
So we've talked about different options, and it seems like a veneer would be the best treatment. Given the cost of the procedure, are you happy to go ahead?
It's quite expensive, but I definitely need to get it fixed. Will it stay put?
Veneers tend to need replacing every 10 to 15 years, so they are a long-term solution. It will certainly be more durable than composite bonding, and it will look more realistic too.
Oh, okay. That's great. And is there anything I can do to extend their lifespan?
Well, you need to maintain good oral health. You know, brushing, flossing, regular checkups. You should avoid brushing your veneer too hard, as it could cause damage.
Okay.
You hear a podiatrist talking to a patient with fallen arches.
So, you say you're experiencing foot pain. Are you wearing supportive shoes?
I'm wearing appropriate shoes, and I'm also wearing orthotics that should be helping, but I'm still experiencing pain in my feet. Sometimes they feel a bit numb, too.
Right, okay. And you mentioned that you've been given some foot exercises to do?
Yeah, the physiotherapist I went to showed me those. At first I thought they were helping, but now I think I'm as bad as I've ever been. Is there anything else we can do?
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at extract 1.
I wrote a prescription for antibiotics. I did want to talk to you, though. I'm a little bit concerned looking through his chart at how many ear infections he's had recently, and I noticed that you had checked the box that someone's smoking in the home, so I was wondering if you can tell me a little more about that.
Well, it's just me and him, and I do smoke. I try really hard not to smoke around him, but I've been smoking for 10 years, except when I was pregnant with him. But it's so stressful being a single mom and having a full-time job, and so it's just, that's why I started smoking again.
You have a lot of things going on, and smoking's kind of a way to relax and de-stress.
Yes, yeah. Some people have a glass of wine, I have a cigarette.
Sure. And it sounds like you're trying not to smoke around him. Why did you make that decision?
I know it's not good for him. I mean, I've read those things about ear infections and asthma and stuff, but other kids have ear infections and their parents don't smoke.
So on the one hand, you're worried about how your smoking might be affecting him, and on the other hand, you're not so sure if it's really the smoking that's causing these problems.
Right. Yeah. I mean, he doesn't have asthma. He hasn't had a lot of other problems that his other friends have. So, and I've thought about quitting before in the past, but I just don't see how it's possible right now.
What made you decide to quit smoking when you were pregnant?
Well, he was inside me, and we were sharing everything, and I knew that he would get some of that, and I just didn't think I could live with myself if something happened to him.
Right now, though, it feels almost too difficult to even manage or even to try.
Yeah, exactly.
How were you successful when you quit before?
I don't know. I think about it now. I don't even know how I did it. I just did it. You know, I just couldn't imagine like him not being born or going into labor early and him having problems and stuff like that, all the stuff that they talk about with women who smoke. So that was just enough to say, okay, you know what, I'm not going to risk that.
Mm-hmm.
So
the risks were so scary then that you're able to stop. But
yeah.
They don't feel as scary to you now.
No, I mean, we're two separate people, and like I said, I try really hard not to smoke around him. I'm pretty good about that. I don't let other people smoke around him. So
You're doing the best you can do.
Yes.
Yeah. Okay, but it sounds to me, too, like part of you really does want to quit.
Yeah, I know that I need to, and I keep, every new year, I say, okay, this year I'm going to quit smoking, but then something happens, and it just doesn't.
It's on your to-do list, it's just not making it to the top.
Yeah,
if you did decide to quit, on a scale of 1 to 10, where 1 is not at all confident, you don't think you could do it, and 10 is you feel pretty certain that you could, where do you think you fall right now?
Probably like a 5. Kind of in the unsure area. Like, I know I've done it before, so I know I can do it, but at the same time, it just seems really hard, and it's not the same situation.
Well, what made you say 5 rather than 2 or 3?
I know all the ways it's bad for me, and I don't want him to grow up thinking that it's okay to smoke. I don't want him to use any kind of, I don't want him to chew or anything like that. So I know I need to, especially before he gets old enough to understand what mommy's doing, but I just don't know if I can do it.
Okay. So it sounds like you have a lot of reasons why you'd like to quit. You have been successful quitting in the past, and right now you're just feeling a little bit hesitant about your ability to do it.
Yeah.
Where do you think we should go from here?
I don't know. I'd like some help. I just don't know what kind of help I need.
Sure. Well, if you'd be interested, that's something I can definitely talk to you about. There are a lot of new options that can actually help people be way more successful in their attempt at quitting. There's different medications you can try.
I don't like medicine.
Okay. There's also a lot of support groups and classes that you can take where you have other people to go through it with you, and sometimes just having that support can be a big part of it, especially for people like you where smoking is such a stress reliever.
That sounds nice, but I'm not sure if I have the time for all that.
Sure. It feels like something that would take up a lot of time and maybe not fit into your life. I wonder if we could talk about some options that might fit into your life.
That would be really nice.
Okay, well, if you're willing, then we could set up another appointment where you could come in and we could talk more about that.
I would like that. That would be great.
Great.
Thank you.
Sure.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Maya Angelou couldn't escape the nagging doubt that she hadn't really earned her accomplishments. Albert Einstein experienced something similar. He described himself as an involuntary swindler whose work didn't deserve as much attention as it had received. Accomplishments at the level of Angelou's or Einstein's are rare, but their feeling of fraudulence is extremely common. Why can't so many of us shake feelings that we haven't earned our accomplishments, or that our ideas and skills aren't worthy of others' attention? Psychologist Pauline Rose Clance was the first to study this unwarranted sense of insecurity. In her work as a therapist, she noticed many of her undergraduate patients shared a concern. Though they had high grades, they didn't believe they deserved their spots at the university. Some even believed their acceptance had been an admissions error. While Clance knew these fears were unfounded, she could also remember feeling the exact same way in graduate school. She and her patients experienced something that goes by a number of names: imposter phenomenon, imposter experience, and imposter syndrome. Together with colleague Suzanne Imes, Clance first studied imposterism in female college students and faculty. Their work established pervasive feelings of fraudulence in this group. Since that first study, the same thing has been established across gender, race, age, and a huge range of occupations, though it may be more prevalent and disproportionately affect the experiences of underrepresented or disadvantaged groups. To call it a syndrome is to downplay how universal it is. It's not a disease or an abnormality, and it isn't necessarily tied to depression, anxiety, or self-esteem. Where do these feelings of fraudulence come from? People who are highly skilled or accomplished tend to think others are just as skilled. This can spiral into feelings that they don't deserve accolades and opportunities over other people. And as Angelou and Einstein experienced, there's often no threshold of accomplishment that puts these feelings to rest. Feelings of imposterism aren't restricted to highly skilled individuals either. Everyone is susceptible to a phenomenon known as pluralistic ignorance, where we each doubt ourselves privately, but believe we're alone in thinking that way because no one else voices their doubts. Since it's tough to really know how hard our peers work, how difficult they find certain tasks, or how much they doubt themselves, there's no easy way to dismiss feelings that we're less capable than the people around us. Intense feelings of imposterism can prevent people from sharing their great ideas or applying for jobs and programs where they'd excel. At least so far, the most surefire way to combat imposter syndrome is to talk about it. Many people suffering from imposter syndrome are afraid that if they ask about their performance, their fears will be confirmed. And even when they receive positive feedback, it often fails to ease feelings of fraudulence. But on the other hand, hearing that an advisor or mentor has experienced feelings of imposterism can help relieve those feelings. The same goes for peers. Even simply finding out there's a term for these feelings can be an incredible relief. Once you're aware of the phenomenon, you can combat your own imposter syndrome by collecting and revisiting positive feedback. One scientist who kept blaming herself for problems in her lab started to document the causes every time something went wrong. Eventually, she realized most of the problems came from equipment failure and came to recognize her own competence. We may never be able to banish these feelings entirely, but we can have open conversations about academic or professional challenges. With increasing awareness of how common these experiences are, perhaps we can feel freer to be frank about our feelings and build confidence in some simple truths. You have talent. You are capable.
That is the end of Part C. You now have 2 minutes to check your answers.